Hello, good evening, everyone, and welcome to another session of the Kindness Revolution, the Leeds Festival of Kindness, Compassion and Wellbeing. And this evening, we're going to be hearing from something a little bit different from what you've been seeing earlier in the week. So this is about a project that is happening a long way from Leeds in rural Kenya, but it's been started in Leeds. It's being run by a dedicated and brilliant group of people here and their partners in Kenya. And we're going to meet them, some of the partners, and hear a lot about this amazing project, which is really improving the lives of people who are living in some of the most difficult circumstances of, poverty and problems of disease and so on. So I'm not going to tell you any more about it right now because I think I need to let Anita Jones, who's initiated this project, and her team to tell you more about the Mama and Mtoto, the Mother and Baby Project, and I think you're going to be inspired. So I'm going to hand over to Anita now to tell you a bit of the background.
Hi, my name's Anita. I'm a midwife in Leeds. I've always been a midwife in Leeds for a long time. And we run projects in Kenya. And I'm going to introduce you to our partners. But first of all, I'll introduce you to the other members of the charity Mama na Mtoto UK. And I'll pass you over to Christy.
So I'm Christy and I'm a social worker and I work in Leeds within safeguarding in another charity, and I share my skills and my experience with our charity in Kenya.
Okay, John?
Yes, I'm John. I currently work as a volunteer in the shop in Keighley, and I do health and safety as well when it's needed. Yeah.
And you're one of our trustees, which is brilliant. Right. We're really pleased about that. Okay, so I'm going to go around the board to introduce you to everybody. So the next square down is two really important people to us, which is Marianne and Wazwa. So if you want to introduce yourself, if that's okay.
Yeah, thank you. I'm Ruben Waswa, and one of the directors of North Coast Medical Training College in Kenya, in the coastal region of Kenya, Kilifi specifically. And of course, our business is training mid-level or primary healthcare health workers. And I think it was great to meet Anita and our colleagues, who kind of came with the ideas that we had, and we joined our heads together. And I can say we are doing a good job to inculcate that primary healthcare approach to training in a very effective way. Thank you.
Yeah, pleasure. My name is Marianne Darwinkel. I am Dutch originally, but I've been living in Kenya for the last 17 years or so. My background is in medical and social. I'm a medical doctor by profession and also an anthropologist and epidemiologist. So I'm one of the co-directors at the college, and together with the college, we have a foundation called Community Health Promotion Fund, because we really try to combine the health service provision and the training so that we inculcate also real attitude change, as was said, in the younger population, but we also implement and participate in the implementation of community health projects. Thank you.
Thank you. Thanks, Marianne. Eddie, do you want to say hi?
Hi, everybody. My name is Eddie Kono. I'm a nutritionist by profession, and I am the project coordinator with CHPF. As a project coordinator, I help in implementing of the various programs which are being funded by the Mama na Mtoto. So that's all. I'm on the ground in implementing of the programs with the North Coast Medical Training College and Community Health Promotion Fund.
Thank you.
Thank you.
Thank you. And Paul, would you like to introduce yourself?
Hi, my name is Paul Adoch. I'm the director at Trace Kenya. Trace Kenya works in the coastal region to ostensibly fight human trafficking and specifically to promote the protection of children and girls mainly from sexual exploitation and particularly commercial sexual exploitation. Mama and Mtoto works with us in partnership in rural Kilifi, where we provide reusable sanitary towels to girls and offer them psychosocial support, counseling, and what we basically call girl talk, where one of our staff works with the girls in the community to ensure that then girls are empowered and able to secure their personal agency and be useful members of their communities.
Thank you, Paul. And Judy, it's nice to see you.
Nice to see you too. Good evening, everybody. My name is Judy. I work at Trace Kenya, and I'm the one implementing the project on ground. Thank you.
Thank you. So what I'm going to do is I am going to share a PowerPoint presentation with some videos of actual work that we've done in Kenya, so you can get a flavour for it, because if you've never been there, it's really hard to actually know what it's like. So I'm hoping that you get a really good picture. There is a lot of slides and a lot of information, so I'm not going to read every word on every slide. I want you to just get a feel of what we're doing in Kenya, and each person delivering the different elements of the projects will talk about that. So I'm going to share the screen now. Can everybody see? Can you see that okay? Yeah. So how do I start it? Okay. So these are our the people that are helping us at the bottom, but we are going to go in and go into a bit more detail. So it means mother and baby. I'm a midwife, so it's very important. Mothers are very important to us, and they're very important to their families, and we recognise that. Okay. Okay, so let's have a look of who we are. We've already said that we're a UK registered charity, and we actually started in 2015, but we started really doing work on the ground in 2016, because obviously without funds, you can't do much work. So we spent the first year doing that, okay? Very small but effective charity. And we are in line with the United Nations global goals. So a lot of the work that we do, it's not new. People already know about this, and people are already working around the world towards those goals, and our projects are in line with that. So basically, we want to reduce inequalities in Kenya and increase midwifery care and safe birth and sharing good practice. So all those things that I've listed there, we're going to go into more detail. And so I'm going to move on so you can actually see some of the work that we do. We have got a vision. We want women to live, we want them to look after the babies, and we want the babies to live and families to be healthy. We also want to empower people. We want to empower women to be able to make the right choices. But you can only make choices if there are services out there that you can choose. So it's really important that we help with that, with the infrastructure, and we want to improve the quality of family health and protect children. We also think high quality services is really important. So training and sharing good practice basically is what we want to do. Our principles are to build a wider story of well-being. So not just in Leeds, but globally, through collaboration and kindness. You know, the fact that our principles are equity, integrity, and definitely compassion and empathy for people. And I think one of the things that I noticed in the beginning about working in Kenya was there's lots of different agencies doing some really, really important good work, that they're all different. So an HIV charity is dealing with that. And another charity might be dealing with something else. But what we wanted to do was look at holistic care, because you could prevent a pregnant mum from passing HIV onto a child, a baby. But then if there's no services for her to have a safe birth, then you know, that's sort of counterproductive. We actually need the services so she can deliver a baby safely and be healthy. And a lot of women die in Kenya from preventable causes like anemia and preeclampsia, all the things that we don't hear of here in this country. So it's really, really important that we get those services out to women and that they can access them. And why we're doing it in this area is because of all these reasons. The remote areas, they've got a high level of deprivation. They haven't got the infrastructure we've got here. So the housing, electricity, water, all those services, the utility services that we just take for granted, they haven't got those. A lot of them are suffering from malnutrition, and the healthcare is inadequate for their needs. Teenage pregnancies are high, infection rates. So they've got lots and lots of problems that they need to deal with, but they're very strong and they're very resilient, and they want to improve the family life, okay? I think that's quite important. You know, a lot of these mums want the same as we want. So our projects, the first project started out the Mother and Baby project, and we've actually got in-reach and outreach care. Sometimes our workers go into people's homes, and we work in partnership with the North Coast Medical College, as you've heard there, and they're going to tell us a little bit more about the work on the ground, and how our project supports their students to learn, to get experiential learning. The second project that you've heard about is, we're calling it Periods Are Not Just a Pad, because we think giving out the sanitary pack is really, really important, because it means young girls can go to school, but it's not everything. It's that conversation with that young person. It's about consent. It's about being healthy. It's about healthy relationships. It's about contraception and actually, you know, making the right decisions in your life, okay? We also do sexual health work with men, and we have the elders of the village, the Bamani village, help us to do that, to get the men together. And Christy's going to talk a bit more about that. And then we've got the borehole that we dug last year, fully understanding that without those utilities, it's very difficult to get the infection rates down. And so last year we built a borehole, which has been really successful. And we've done, repaired the incinerator in the dispensary, we've put up signs, we've done an underwater storage tank there, and you will see pictures of that. And we also, because it's holistic care, we actually, if we see a problem, like if a pregnant lady's got 3 children of school age, but they're not going to school because they've no uniform, then we try and get the funds for the uniform. Because holistic care is about understanding that she then gets her children going to school and educated, they will get a meal at school, and she will have some time to rest and think about a pregnancy and think about her unborn baby. So it's about looking at those, all the different things that affect someone's health, and that's a holistic approach. So I'm just going to pass you over to Christy now to talk about our support in the UK.
Yeah, so we have lots of wonderful people supporting us from different organisations, volunteer groups, and this is just a few of the people that do support us. And every bit of support counts, from the volunteers who are selling jam in jars to those who are knitting teddy bears and dressing up dolls to sell in the shop, and the support that we get to take to Kenya as well. So we get lots of lovely resources donated that benefit children in Kenya. So in Kenya, we have lots of people who work alongside us, as Anita has mentioned, and that's people from Trace, North Coast Medical College, to local schools and Rotary clubs, and all the support makes a big, massive difference from both here and in Kenya.
I'm going to show you a film that the North Coast Medical College made for us. give you a little idea of what it's like to live in Kenya.
Tangu hii huduma ya mama na watoto ianze, basi sipati shida hata kwenda mbali hata kutafuta madaktari tena. Tunawapa wakina mama huduma iliyo kamili, tunawahimiza waende kliniki na kuwa tunapata pia usaidizi wa daktari wa karibu, kwa sababu hili hema lililojengwa hapa kwetu kijijini Junju, huwa tunafurahi tunakutana na madaktari wakati wowote.
Student from Northwest Education College, I'm so happy to be in the community. I'm experiencing a lot the problems facing our parents in the community, and I'm glad to be part of the community. Community health worker, we are happy, we are serving the community, and I really appreciate this program. It has enabled me to reach my people, and I'm still serving them.
Bye bye, kwaherini, mtukumbuke tena.
Okay, so that was just a little flavour of what it's like in a village, and the students and community midwifery support workers helping the people in that village. These big blue tents that you see here are semi-permanent buildings that we've helped to fund, and this is where the project is an outreach project. So it's very close to the women in the villages, and they can actually come and receive care there. And you can see that a pregnant lady is getting an antenatal check there, and some of these ladies that are postnatal women with their babies are actually getting some clothing from our project. And I think it's always good to remember that lovely little baby at the top there, the newborn baby, and just how vulnerable babies are and how important and precious they are. This is another short video. I'm not going to show all of it because there's not a lot of speech, but during the COVID pandemic, a lot of our workers and students have gone out into communities to show them about hand washing, to give them masks and to protect them. So this is one of the workers doing that. So what she's doing there is she's telling them about hand washing, and she's telling them because obviously they don't have the radio, television and all these things that we have to get the information. So we have to have people going out and telling them about things, and that's what's going on there.
Jumatano huwa wanahudumia watu wa shule, Alhamisi wanatembelea vijiji na Ijumaa. Ni sawa. Leo wamefika huku kwetu kwa sababu wamemwita mwende Junju au kwenda Junju mpaka wamechoka na kwa mambo ya shule.
So we're going to go on to our periods are not just a pad project, and I'm going to ask Paul and Judy to talk a little bit more. Judy's in the photographs here, doing one-to-one conversations with young women. And that is our sanitary towel pack that we give out, so they get pants and reusable, washable sanitary packs. Paul, do you want to explain?
At Trace Kenya, we protect children and we empower girls and young women, particularly from commercial sexual exploitation. And some of the forms in which they find themselves vulnerable to exploitation is when they have little money or insufficient monies to get as little as dignity packs, sanitary towels. So through our project, we partner with Mama na Mtoto in order to provide girls in our community with reusable dignity packs. I'd like to ask Judy to continue explaining what exactly happens on the ground for a few minutes going forward. Judy?
Thank you very much. We were very glad to be part of the Periods is Not Just a Pad project program. And in most circumstances, people look at the lack of pads as, one of the things that causes children or girls to be exploited. But there's more to that. And when we look at periods not being just a pad project and taking care of the mental health of these children, it is very important. There was a lot of positive feedback and responses from the children. There was a change of, perspective about life. There was a lot of positivity throughout the program. And these children at first were a bit scared to even open up and share what's going on in their lives. But the more I showed up, the more I cared, the more I shared what was going on and encouraging them and having different talks with them, they saw that, yes, somebody cares beyond just giving them the pads. And we were able to reach over 280 children, actually girls, and it was a wonderful experience. It's actually been a wonderful experience handling these children. And they look forward to the talks even more than receiving the dignity packs. So their mental health is in check. They're always bringing new people. They're always bringing new girls. They're always bringing, people from the villages to come and listen, to come and share. And they feel that they're part of a group. And where the project is run is, deep within the villages. We are used to working in the town areas and we forget, the village areas, the remote areas. But when we went there, these children were so grateful. They were so appreciative of the services we were giving. And I wouldn't say there was any setback for us, apart from just a few hitches with the COVID-19, but it even gave us a bigger avenue for us to be able to share and to do more health talks when they're in groups. And we had so many girls come out, out of their shells, out of the fear, and things are getting better for these girls. So the periods is not just a pad project, has really impacted on the lives of these girls positively. And they are becoming, community champions in sexual and reproductive health matters. So we are nurturing a generation of young women and girls and students who can actually stand up for their rights and reduce the rate of sexual exploitation that is happening in this area in Kenya. Thank you.
Brilliant, thank you for that. That's really good, and it makes it alive. It makes us understand exactly what is happening there. And what we are going to do is just expand a little bit on the CSE work that we do. So Christy's now going to talk a little bit about some of the outreach work that we've done.
Yeah, so we've done a number of outreach work in Kenya around safeguarding and supporting children to seek help and support where they might have been neglected in any form of way, really. So whether that's training of professionals, we've also done work on the ground with children, young people and men. So we've done several talks with the border board, which are also known as the motorbike boys or men, and that's been around contraception, sexual health, and just breaking general myths around pregnancy and sexual health that they may have, and asking them questions that they may, you know, not feel confident in asking anyone else or not know, or just general things that they did believe. We've actually brought them myths with them. We've also done a session with young people around seeking support if they've been sexually abused, and a lot of children, young people weren't aware that possibly have been sexually abused. So an example is, here in this country, we're very lucky to have the Underpants campaign, and that teaches children and young people that your parts are private and they're private to you. And if anyone is to touch them parts, then you need to speak to a safe adult. So we've done that in schools across Kenya to show them that, you know, what body parts are yours, and if that has been breached in any way, where they can get support. So that were a lot of work for us in terms of finding out what services were available and ensuring that children and young people were accessing them services available to them.
Okay, thank you. We actually do go into North Coast Medical College as well. We've done training with students, both midwifery and safeguarding. And we've also done the teachers at Junju School, which is where the drop-ins, where Judy works. We've done some training in there as well. So, and it fits in nicely, the prevention work around CSE and unwanted pregnancy fits in nicely with the Mother and Baby project. So that if young women do get pregnant, we can support them. And so there are two main projects. The other work that we do, the environmental projects, I'm just going to show you some clips from these slides, mainly because we're so pleased. And I've never actually seen a borehole dug before. And this work went on for 3 weeks, and we had double staff apparently, because it usually takes a lot longer than that. And I just want you to have a look at the determination and how hard people work in Kenya. So this is digging the borehole. It's 120 foot deep. And I'll just show you what the children are like when the water comes. It's amazing. Well, we were all jumping around as well. So let's have a look at this. So this is the borehole. It's just starting now. Okay, so it does seem pretty low, because that man stood on there for 12 hours a day. And I think he's keeping the drill in place. I'm not sure, I don't know the mechanics of it, but I just know it was amazing when this happened. When the water came and the children wanted to actually play in it, that was fantastic as well. And this is our latest video of the borehole and how people are using it in a really sensible way. It's free water. There's 2 taps to the borehole, and obviously it needs electricity to run it as well. But it's all very orderly, and everybody's queuing up to get the water, which is fantastic. Okay. So the last 2 pictures on here are the underwater. This is the Bamani dispensary, where we actually built an underwater tank so that they could store the water. And the middle picture is their incinerator, so that they can actually burn hazardous waste. And I'm sure everybody understands that washing things when you're ill, you know, when you've had a baby, getting washed, getting rid of hazardous waste is so important to reduce the infection rates, and really does improve the health of a village, of a population. And I just had to put this picture in because I just think it's so amazing that these children are so happy that they were jumping around, especially the one at the front. He's so tall, so clever to jump like that, which is fantastic. So we know that what we're doing is really appreciated. And working holistically does mean that we give out lots of donations. So there are mother and baby packs, and we've got lots of teddies that people make for us. We take lots of medical equipment, and so we do quite a lot. We work in the prison, mother and baby as well. And one of our projects, obviously one of Jeremiah's back here really, not that just because I love him. And I think it's just an example of this little boy could not sit up. He was in his mum's arms all the time, or on the kanga, or he's in the dark, really laid flat. So he'd never really sat up independently. So we decided that we would get some funding to get him a chair. We bought him a lot of chairs because he's now 9. This was the first one, and I know it doesn't look very nice, but this is the first time that he's actually sitting up. So it means when he's eating and drinking, he's not choking like he was before. So it's quite a big milestone for him. So he does look worried. This is Jerry's finished chair. Hi. Hi, Jerry. Let's get all of it. And his mum. Hi. Hi. And it's holding his head in place. Hi. This is a nice chair, huh? You can sit up now, huh? Yeah, hi. You're not smiling. Jerry. You're not smiling. Oh. Says, I don't know where I am sitting up like this. It's strange. Okay. Aren't they? Huh? Yeah. Why are you smiling now? You're getting used to it. Yeah. Huh? And this is the first time he's sitting up without his mum holding him. Okay, so we'll stop it there. And obviously this is a picture of Jeremiah when he's really small, and he's quite long and tall now, so he's got other chairs. He doesn't need to be strapped up, and actually he can support himself now, which he couldn't do before because he's had a lot of physio and a lot of help. Okay. I'm going to pass you over to John for the last couple of slides, just because we really, really need your help. As I say, we're very small and we work really hard for the funds that we get because in the shop. So I'm going to let him tell you a little bit about that. Can I pass over to you, John?
Yes, certainly. Okay, we have just one shop in the main shopping centre in Keighley in West Yorkshire. And it's a very popular shop. People who come in are regulars. There's quite a lot of people who return even every few days to see what we've got. And we get lots of good compliments about the shop. Most of the funding that we get in the shop is from donations, where we go to people will phone us up or come into the shop and say they've got donations to collect. We go to their houses and collect all sorts of goods, either clothes or bric-a-brac, cutlery, pots and pans, plates and cutlery, etc. And we bring them back to the shop. We sort out anything that's good or not suitable for sale, and we then put it into the shop. The shop is run only by volunteers. Excuse me. We never have enough volunteers. We always need more volunteers. So any additional help from that point of view would be most welcome. But the volunteers we have got are all dedicated to the project and the aims that we have for the charity. And the volunteers are always very adaptable. They do all sorts of jobs in the shop, either selling, tidying up, cleaning, steaming the clothes to make them look really good before we put them on sale. But as I said, we do need more volunteers. The funding that we work on is, we also get plenty of support from other local organisations such as Sir Optimist International, from the Lions, from a Lions subsidiary called the Shed in Keighley, and also from Rotary. We've been told that some of those charities will give us large donations at the end of their year. Whether that will continue or not, we don't know as yet, because maybe COVID has affected it in some way. But they're all very supportive of us.
Yeah, sorry, I just wanted to, because when we're mentioning about subscriptions and helping us, I just wanted to give Wazwa and Marianne and Eddie a little bit more time, because we haven't really heard a lot about what the Mother and Baby Project is doing, and I know that they've done some fantastic work with women and children. So if we could go back to you just to finish off, if you don't mind, Marianne, so that you can just talk a little bit more about how the students benefit and how the local community does from the project. I know you've said our aims are the same, but can you go into a bit more detail about that?
Yeah, so thank you. I think we are good partners with the Mama na Mtoto, and I think one is that, as we said, our goals kind of just sync together or came together, and we are happy because our main aim as a North Coast, which is a mid-level training college, training primary healthcare, located in a rural area. And actually the reason we have been in existence for now about 8 years since we established the college. And before that, Marianne and I were working with the public health system. And one thing we realized actually that motivated us to start the college was the fact that there was very little done for the community, rural communities. Most of our health system is kind of centered in the urban areas, and most qualified people, midwives and all that, want to work in urban areas for obvious reasons. That's where more money is and all that. But for us, we went for that. And I think when we came on the ground to start working, we were very clear with a vision to help the communities and focus our training towards community-oriented to make it community-oriented and competency-based. So around the same time, we engaged the county government of Kilifi, where we work, and we wrote a memorandum of understanding to give us permission to be able to manage a population of around Bomani area, a population of around 12,000 people. And what we are looking at is to try to manage this, wholesomely manage this community right from the beginning, the pregnant mother, the child.
Sorry, Eddie, do you want to say anything in Wazwa's absence? I think the signal's gone for him.
Yeah, thank you. So basically, we with North Coast, implementing of the Mama and Mtoto project. So basically, the primary healthcare, we've divided with the students as part of their attachment in the community. So we have programs that we are implementing, and one of it is the Mama and Mtoto program. Then we also have the In and About Pregnancy program, which is also being implemented by the students with us, the coordinators. Then we have a program for the elderly, then our program for the adolescents, so a program for the men. So all these programs are being implemented by North Coast Medical Training College. And actually, when now Mama Mtoto came in now, actually we are now supporting the pregnant mothers and the under 5 for the Mama Mtoto programs, because now those are the programs which are being supported by Mama Mtoto.
Thank you.
Thank you.
Yeah. I think the thing that I want to emphasise there with North Coast Medical, just to finish off, is to say that students were not working in the community before, and that they were getting experience in hospital, but not in people's homes. And if you're going to deliver something holistically, then you have to know socially how people are living, what they're living with, what the challenges are. Okay. And I think coming together, students, ladies who are working and trained to work in the community, and ourselves, it's a really good partnership, because it means that the outcomes are absolutely brilliant, because the women know their own village, they know the people in the village, you know your work, and we also know what we're trying to do. So working together as in a partnership is really, really good. Okay, so I realised that the slide that I'm showing at the moment doesn't actually reflect what you're saying there, but I wanted to just give you another opportunity, really, like everybody else, to just share that you are looking after and caring for vulnerable pregnant women, making sure they get the care they need, the medical assistance they need. And what we're encouraging them to do is to go into the dispensary for birth, because in Kenya they have traditional birth attendants that are unskilled and not trained, and it's dangerous. So we're trying to educate the women to go in, okay, to have the babies with medically trained people. Okay, so I think that's the end of the PowerPoint and the end of our talk. We obviously do need your help, and there's various ways that you can help there. You can go on our website. I'm just going to show you one of our, why does it do that? I'm just going to show you one of our characters before and leave you with Adele, who is a wonderful, wonderful woman who comes in our shop probably 2 or 3 times a week and spends about £40 every time she comes in. So she is supporting and really helping a lot of people in Kenya. And there she is. That's Keithley, that's our shop. That's one of our regular customers. They don't all dress like that. She's just very flamboyant, I suppose you could call her, but she's got a heart of gold, and she is helping the charities we run in Kenya. Okay.
We depend on our shop because that's our biggest way that we raise funds. So volunteers are really important to us, and every little support counts. We want to say thank you for listening and thank you for making a difference. And you know, your support does matter. Without you, there's no work in Kenya being done by our charity. So thank you from all our supporters and trustees at Mama and Mtoto and our volunteers.
Thank you.
So I just want to say a huge thank you to Anita and Christy and all of the team for showing us just a little bit of this extraordinary project, which has, you know, so many different aspects and so much attention to the detail of people's needs to be able to actually make sure that the efforts and the interventions that are given don't actually go to waste and do really reach the people and change people's lives. This charity is running on an extraordinarily small income, and I just wanted, before signing off, to encourage everyone to please go and check out the website. there should be, by the time you view the website, there should be a donate button on the website, or otherwise you can go to the Facebook page. Please contribute generously, because this project can expand if it gets more funding, and reach many, many more people in this very, challenging area and the problems that are there. And I'm so inspired by what the group and the partners are doing here. I want to just cheer them on and say thank you so much for bringing light and hope and help into the lives of people who are in quite a difficult situation. An incredible example of compassion in action. Thank you, everyone.
Thank you. Thanks.
Thank you.